Next up, I would like to move on to the panel discussion. So our panelists are ready to delve into the theme of inclusion, innovation in action. So get ready for a really engaging discussion, and please welcome to the stage Mental Health Reform's Policy and Research Manager, Ber Grogan.
Thanks so much, Shauna. So instead of coming to the stage, I might actually just stand around here, and we're going to bring our panel up, and I'll walk along so they don't know who we're going to ask a question to, just to keep everyone on their toes. I'm taking a leaf out of Jenny's book of getting the energy going earlier. Delighted to be here today. It's absolutely amazing. And just to say at the start as well, I think some of us has mentioned about, oh, we're all in these rooms, or we're always all together, or we're all saying the same things, or we know the same things. And I think one of the really special things about this morning is we're bringing new groups together. So there's definitely people here who haven't been to some of our mental health reform events before, or met with some of our members. That's also why we're trying to give lots of time for the tea and coffee and chats and continuing the conversations outside. If you're anything like me, it's like a bite-sized whistle-stop tour of really, really great things that are happening across the country. And despite what Ruth said, I'm not an innovator at all. I'm here at my notebook. I was talking to Jason from CFI earlier, and we've decided we're going to call them retro if you're using a notebook and pen. Aria tried to give me a tablet there, and I was like, no, I'll just go with my notes. So apologies. But I'm also of that generation that, we didn't have mobile phones or social media or anything like that growing up. So I am delighted to invite up, we have 5 brilliant panellists, so you're not going to hear too much from me. They're bringing a wealth of knowledge and expertise around the sector. We know there's an evolving digital landscape in mental health, and that innovation knows no bounds. And I think what's been really important this morning as well is the talk about innovation that happens by changing your mindset, the new ways of doing things. And I think it's really important as well. Fiona said at the start about funding, and I will shut up now, I promise. I can see Connor being like, get the mic off her. The voluntary and community sector, like things like that of a number of different email addresses and centralising it into one email address. A lot of really small organisations don't have the IT infrastructure to run all of these amazing innovative technologies. We wouldn't even necessarily have funding for staff to have tablets or mobile phones and social media. So I think it's just worth bearing in mind, particularly for those of you from the other sectors, that sometimes the wonderful technology, that you have within your organisations, it's not like that for a lot of us in the charity sector. So that's why we're always learning, and we're trying to do more with less. So I will shut up now, and I'm going to invite up Ivan Cooper from The Wheel, Dr. Ronan Glynn, Elaine, Ciara Glynn, and Ruth, if you'll join us again, please. You can sit wherever you'd like. There's microphones there for everybody. Ciara and Ronan are not related, I'm assuming. I didn't ask them.
We had that conversation. I asked him outside.
Did you?
I don't know many Glynn, so anytime I meet one, I'm always like, hey. So.
Yeah, because I've just seen the two surnames on the agenda. I was like, yeah, we'll have to say that now. Instead of going into everyone's bios, hopefully you all know them. Their names and their faces speak for themselves, and there's also speaker bios up on our website, on the webpage on Inclusive Innovation. So I'm going to dive right in. I have questions for you, but this is very much a conversation if people want to jump in as well. If we don't have time for questions and that at the end, please do continue the conversation outside. So Ivan, I'm going to start with yourself as CEO of The Wheel. We've talked a lot about collaboration across the voluntary and community sector here this morning. So can you tell us a little bit about The Wheel, what you guys do, and how that working together is important?
Okay, thanks, Bert. Can everybody hear me? Yeah, good. So The Wheel is Ireland's national support and representative body for community and voluntary organisations, charities, social enterprises, things like that. And I just thought I'd just very briefly introduce the wider sector that the mental health sector is a part of, and it's really kind of extraordinary, There's over 30,000 very loosely defined community and voluntary organisations in Ireland. They'd include sporting organisations and arts organisations, community organisations of all sorts. There's 12,000 officially registered charities in Ireland, okay? Of them, 4,000 are schools, so there's 8,000 non-education, non-school charities in the Republic of Ireland, okay? And thousands of them, and this is the pertinent bit, are involved in, I suppose, what you might call in Ireland our hybrid model of public services provision. So we have literally got thousands of organisations funded by the HSE, funded by TUSLA, providing what in other jurisdictions would be regarded as essential public services. 1 in every 3 people, it's a remarkable stat, involved in providing public services in Ireland works for a publicly funded or part publicly funded independent community and voluntary organisation or charity. So these organisations are an essential part of our public services delivery system. And what we in the Wheel do is we provide support, advice and guidance for all of those organisations, and about 2,400 of them are members of the Wheel, and we try to engage with them, find out what the issues are, some of which I'll reference shortly, Burr, and we provide information, advice and guidance and training for them. So that's what we do.
Great, thank you so much. And the digital innovation piece is and inclusiveness is an aspect of your pre-budget submission and your pre-budget campaigns. Can you tell us a little bit more about that?
Yeah, so I suppose there's a wider piece in relation to, we heard innovation nicely defined earlier on by Fiona, you know, in relation to doing something new or doing existing things in new ways. And really, it's one of the things, again, Fiona referenced, that the community and voluntary sector does really well. And there's some reasons why that's the case, I suppose. Part of it is that the community and voluntary sector itself, we're kind of closer to communities, perhaps, than centrally delivered services might be. We often have a mix of funding streams, so some of the funding is raised independently, which means that we're in a position to take perhaps a little more of a risk in relation to what we do, and we can innovate. But like everything else, innovation and learning really can only take place in a well-resourced, secure kind of a context. It's hard to take risks or innovate or experiment if you're worried about, you know, where literally the next paycheck is coming from. And there's some issues in this wider sector that's worth we mentioning now, just in relation to creating the context for innovation. Because it's all very well to talk about innovation, it's another thing to do it well. So really, only about 15% of all of the organisations that I've mentioned, these thousands of organisations that are providing services funded by the HSE or TUSLA or the Department of Education or others, receive what's called multi-annual funding. Okay? Now this won't be a surprise, universities and others are often in similar contexts, but it's a reality. Many of the organisations, for instance, you know, you might have organisations that are getting hundreds of thousands of euro a year, or even millions in some cases, from these agencies to provide services. And even halfway through the current year, they still won't have a contract signed for this year's funding, let alone security about where next year's funding is coming from. So we have a simple ask in the context of our pre-budget submission that all of these organisations should be provided with multi-annual funding. It's not really a big deal. There's plenty of precedent for it there. It's just a case of the Department of Finance and the Department of Public Expenditure and Reform and other departments releasing funds for a longer term kind of a commitment. So multi-annual funding, crucial. Another piece is just simply the adequacy or inadequacy of funds. Now we know, and we've heard from many of our contributors, that money itself isn't going to solve the problem, but there's a massive problem currently, and that is that for many of the people working in this sector, providing services and supports, pay scales in the sector have fallen between 10 and 20% behind pay scales in the public services that now apply. So what we're finding is there's it's like a food chain, okay? There's an exodus of talent. We talked about talent earlier on, out of the community and voluntary sector, and in fact, a lot of it's going into the public services, okay? Which in itself isn't a bad thing, but what it means is that the community and voluntary organisations in questions cannot retain staff. So we have a second call in the context of budget this year, and that is that the public, recently negotiated public pay deals that processes are put in place to ensure that the funding for organisations that employ similar staff for similar work done in the public service is increased to enable them to pay a competitive kind of a salary. And finally, one other point I think it's important. We talked about the importance of collaboration and partnership working, one of the last points made. We're happy that finally, 15 years ago, if you had asked, you know, members of the public or public servants, did they have any real understanding about the huge role played by voluntary and community organisations in our services, there was a very low level of publicly available information on this. So a lot of what I've said is startling and is new, because there has been, through the charities regulator, we now have an actual source of data on what's going on in the sector, and we can see the size of it. But one of the things that the collaboration and partnership working doesn't come easy, okay? It's all very easy to say it. But when it comes down to it, organisations can have different missions. Funding sources can cause unnecessary competition between organisations that otherwise would be collaborating, and even the best of friends in the voluntary sector can find themselves frenemies sometimes, okay, when they unfortunately have to end up competing with each other for a limited pot of funding. And that also goes with the state agencies. So my final point is we were very heartened to see last year, 2 years ago in fact, the government published a new set of principles that all government departments and agencies are now in the process of beginning to understand, to apply them to guide positive, constructive partnership working in collaboration with community and voluntary organisations. There's always an imbalance caused by funding, though. The person who holds the funding checkbook, so to speak, just wields, what's the word, and more power perhaps than they would otherwise have, let's put it that way. And that power is a power that needs to be, that power can trump sometimes commitments to partnership working, collaborative working, and that's something I think we need to solve. So I'll stop there, Bert, thank you.
Thank you so much. Otherwise, we become frenemies now, Ivan. You know,
Indeed.
It's a really good point. And in mental health reform and in the work that we do on the pre-budget submission, like Minister of State for Mental Health and Older People, Mary Butler, Minister for Health, Stephen Donnelly, are really supportive of the work that we do and the work that all of our members do. But we do know that when it comes down to budget negotiations, you know, it's knocking on the Department of Public Expenditure and Reform and Department of Finance. You know, they're the ones that will make the final decision. So they're on our target list, our hit list. Ronan, I'm going to come to you. And sorry, it might sound really weird for people for us talking about multi-annual funding and that you're halfway in the year before you even know that you actually have funding for that year. But that's the path we all chose, who were those of us who work in the community and voluntary sector. Ronan, from your perspective, what role do you think that private sector organisations like EY can play in supporting the voluntary and community mental health sector in adopting and implementing innovative ways of working?
Thanks. Good afternoon, everyone. Great session so far this morning. So I think just to start, always cognizant of the challenges that have been outlined for the sector. But ultimately, I think it was put really well earlier on that innovation is not at all necessarily about technology. And it's about being proactive versus reactive. And in particular, it's about anticipating the future, whether that's challenges or opportunities. And what we've seen, I think, this morning is that the sector is excellent in terms of early adoption, in terms of trying new things, in terms of pushing the boundary that sometimes the larger state organisations can't do. But I guess from my perspective, I like to think that an organisation like EY, where we come in, is that we help organisations then to scale that and to ensure wider adoption for everyone, as you said, Ruth. And from our perspective, again, it'd be really clear that it's not necessarily at all about technology. And the first thing we do when we go into an organisation is a current state assessment. And this does not have to be a long, drawn-out process, but do you understand your data strategy? Do you have a data strategy? Do you understand where your data is sitting? Like there's so much data out there, Google Trends as an example, that we're not necessarily making adequate use of. Do you know where you are on your journey of digital maturity? Do you know what your user needs are? And increasingly, there's the service user needs, but your workforce needs. What do you need to do to ensure retention and to recruit in an environment which is only going to become more difficult into the future? And then I guess if you can understand your current state assessment, what we try to do with people, and look, in my previous role I used to have a bit of a jaundiced eye on this, but we try to define the vision and the purpose. And if honestly, if you can't communicate the why, you're trying to do something and where you're trying to go, you're not going to get there. Can you develop a vision that your organisation, and particularly for this sector, that the state can get behind? And then if you have that vision, if you understand the case for change, you've got to map the way forward. Crucial to that is having appropriate governance in place, having the appropriate sponsorship, again, both within your organisation and at government level. And ultimately, wrapping all of this is change management. If it's going to be equitable, if you're going to roll it out for everyone, you've got to keep people on board on the journey. And I was discussing it with someone at the break. Often when it comes to innovation, whether it's digital innovation or otherwise, we I think form a simplistic view that there are people who will adopt innovation and that there will be resistors. What we probably don't give enough appreciation to at times is that within that group of people who are a bit slower to adopt are a significant proportion of people who are scared. They haven't necessarily been given the digital skills to use these technologies. They might have spent 10, 20, 30 years working on paper-based systems. They haven't had necessarily a good experience of collecting reams and reams of data, submitting it centrally, never getting reports back that actually inform their practice. So all of that needs to be thought about in the context of how you're planning for implementing and sustaining change over the long term.
It's a really good point, and I think when you're saying about change, the other thing that I'm thinking, particularly in the community and voluntary sector, is around the time to do that, particularly if you're providing frontline services, and you have, you know, waiting lists, like we've seen the innovative ways that Jigsaw are dealing with that. So, you know, again, for community and voluntary sector to have that space to put the time into making that change, and again, sometimes that involves, you know, the you know, like core funding for a team member who's going to be able to do that rather than actually, you know, answering the helpline calls. Are there any particular mental health innovations at the moment that you're hot off the press, or anything that's coming up that you're dying to tell us about?
Well, I think, I mean, the obvious area of focus globally at the moment, more broadly, is AI. When we speak to healthcare organisations globally, about 7 out of 10, so 70% are saying that they will rely on a digital-first strategy by 2027. So digital is going to absolutely transform the provision of healthcare more broadly over the next 5 to 7 years. If, like in EY, we would work in construction, finance, aviation, like across the board, retail, and like. If I look, just to give an example, so the CEO of Walmart has recently said that one of Walmart's core kind of objectives for the next 10 years is to revolutionise healthcare in the United States. So if we look at where technology is going to bring us, we will be operating in an entirely different ecosystem of healthcare in the next 5 to 10 years. And I suppose the question for your organisations is, how do you take advantage of that? Because I don't know necessarily that your core stakeholder or holders today, DEEPR, HSE, Department of Health, it's not necessarily the case that they will be your core stakeholders in 5 to 10 years' time as these large players in other sectors move into the space, for better or worse. And I guess the challenge is to ensure that that's for the better. On just one quick point on the AI, because whenever it comes up, so many eyes go to heaven, and it's like, look what we're dealing with. Look at the challenges we're facing with on a day, and you're talking about artificial intelligence. But increasingly, where we're using AI with organisations, like we can typically develop a use case within about 48 hours, and almost invariably, it's a back office efficiency improvement that we're bringing about. It's not the shiny, fancy, whole of system change, revolutionising, getting rid of 20% of the workforce. It's nothing like that. It's using your data better. It's allowing better appointment scheduling. It's having, like, chatbots are a really important part of how we interact with service users and making best use of those. It's really simply allowing your workforce to access all of the information that you have on your website in a quick, interactive way that mirrors kind of what we do in ChatGPT, for example. So there's an awful lot happening in the space, and I think my message would be just to take a little bit of time to explore the opportunities that are there, and don't assume that it's this really shiny thing that isn't for your organisation or your sector in the short term, because I think it'll infuse everything in the years to come.
And to go off script for a minute, do you think, like, how can the private sector then help the community and voluntary sector, or the people trying to access services? You know, because if you're not working in it, or you're not seeing it every day. Like AI can seem like, you know, the big scary thing that's coming down the road that you know, so people are just hearing conversations about it. So how is it that we bring that conversation into, whether it's schools, colleges, courses, so that it does become a normalised conversation?
So I think it's exactly the same as we try to bring it into our organisation. So like, I get all of these, you know, PowerPoints and messages from our global organisation about AI and what it's going to do, and it's up there, you know. So ultimately, it's about use cases, and it's about sitting down, either within your organisation, sitting down with your workforce or with your service users, and saying, you know, just spending half a day just thinking about it. And I guarantee you, if you give that time, you will come up with 10, 20, 30 use cases, many of which you'll be able to turn around really quickly, and then you can test. And often you can put those into the research environment and test them in a proper way that ensures that you're getting best value on your investment, you know. So I think it is about having the same conversation as you would have with any other technology or any other innovation. It's about starting with user needs and working from there.
So when you say use cases, it's like an example of a piece of work that comes through.
Exactly. So it's rather than talking about AI in a theoretical sense, it's about sitting down and saying, okay, where are our problems within the organisation? And now let's think where the likes of ourselves would come in and say, okay, well, that's similar to a problem this bank had or this insurance company had. So let's look at how what solution do they use, and can we basically white label that and use that here? And as I say, very often we're able to turn those solutions around in about 48 hours and start to test them and see if they don't make sense, they just go in the bin.
Which brings us back, so kind of what you were saying there was collaboration, which, you know, in another way, and is our theme. Elaine, I'm going to come to you next. You work with the HSE in the Organisational Development and Design Department. So what insights can you share with us around collaboration for innovation that's happening within the HSE?
How long have I got for that answer?
3 minutes.
I'm like some of the other speakers. I could talk all day about this, but I did give some thought to what would be helpful within a very short time frame. So right now, as you know, the HSE in and of itself is journeying on a huge piece of transformation. It's completely restructuring. And the goal of that is integration of services. How do we join the dots, join up care, and bring it to the closest point of the service user and patient? So there's two things I'm going to talk about. The first piece is integration. So in the conversations that I'm having with teams at the moment, so I meet healthcare teams right across the country from all sorts of different backgrounds, and they get them to begin to think about how can you create the conditions for integration and change? What's required there? So my question that I would love you to go away with today, back to your own organisations, is to begin to think about what does integration of services look like for our organisation? How are we creating the conditions for that? What opportunities are there to partner with others, including the HSE, to join up how we deliver care? Because we have finite resources, that we've just talked about that. So we have to maximise that in the best way. So that would be my invitation, is to begin to think about what does integration mean for your organisation and how might you create the conditions for it. The second thing I'm going to share with you is what resources are available from the HSE that are openly available to the voluntary community sector. So I have 3 items in 2 hands, so bear with me while I get the clicker. There we go. No, it's completely gone now. Am I getting somebody to come up and give me a wee hand for a second with that? Yep. If you can get it back up there, yeah. So what I wanted to share with you, and it'll eventually make its way back up on the screen, but within the HSE, because we knew the change is going to be an inevitable feature of health and social care services, we wanted to create a framework and a toolkit that every healthcare service and team could access easily. So we created the Health Services Change Guide. And this is essentially your go-to evidence-based practice for how you think about delivering change in any healthcare setting. We're talking about digital and we're very frustrated with it today. It's all about the people as far as I'm concerned, never mind the digital. Okay, it'll eventually make its way up there. So what I wanted to share with you today was the principles of what the Health Services Change Framework is about. And it's very clearly placing people at the centre of it. So people's needs defining the innovation and the change that you're about to bring about in your organisation. And we've heard many examples of that today: user-informed, lived experience. Also the people who deliver services, what's their experience of that? So within the change framework, at the very centre of it, and it will come up in a moment, we say people's needs defining change, and we mean service users, the families who support them, the communities that services are delivered in, and the staff. And at the very, very bottom of the framework, we talk about 9 priority areas, and I'm going to signal where you can access all these resources afterwards, so don't worry. Within that, we talk about 9 priority areas, and I've heard some of them today, and I also have seen some of them reflected in your mental health reform strategy, which is collaboration, understanding people's experiences, collective leadership and approaches, empowerment, building up teams' capacity and experiences, accountability. Ronan has mentioned that. There's a range of different topics within there, and those 9 priority areas are about creating the conditions for innovation and integration. So I'm going to encourage you to access those resources, because while they've been designed in the HSE, thank you. So while they've been designed in the HSE, and this is the framework above my head, and you can very clearly see that we've indicated the central role of people, their families and the communities that support them, and the staff who deliver services. So even though we've developed it in the HSE, and it's an evidence-based practice, it was underpinned by research in Trinity, it is open to every other body out there. We see this as an open source tool that anybody can access. So while I haven't brought boxes of hard copies today, you can access everything on our HSE website around this and the learning tools that go with this. And for anybody who wants to get hard copies, just reach out to us in our team and we'll certainly send them out to you. So the one thing I wanted to do was to make the connection with this resource today, because all the thinking is done within this document. This is the document in and of itself. All of the thinking that you need is in here, and it's supported by a range of templates that have all of the questions that you need to think about. How do you start with a project around change? How do you kick it off? Who do you need to talk to? Who needs to be involved in this? How do you have that conversation? Everything is included in this. So this is the visual of the framework, and it's backed up by a lot of evidence-based practice. So the main thing for here is placing people at the centre of it. But my question is, begin to think about integration of how you deliver your services. And I'm more than happy to take questions on this afterwards, because I'm conscious of time. So I will be here later on if anybody wants to ask a few things. So those are the 2 things. Begin to think about integration and access this resource in terms of how you actually bring about change for new ways of working.
Thank you so much. And it's so true. The HSE website is an absolute vast array of information, and the yourmentalhealth.ie, and even for assisted decision making and everything. So it's probably an underutilised resource for us in the community and voluntary sector. Ciara, I'm going to come to you next. I promised Ciara that we wouldn't be roasting up here under the lights, but it's quite warm. It's quite warm. So can you share some examples of innovative projects that you're involved in that might be outside of the traditional kind of mental health services and supports, and just talk us through a little bit about them?
Yeah. I mean, I wear so many hats, and I've got fingers in so many pies to give each one time would take all day. But I suppose primarily my involvement in all those projects that I'm involved in is I have my own experience of mental health and recovery. So I would have accessed services in the past, and I would have had really severe social anxiety. So yeah, sitting up in a room like this, I've a bit of a contradiction with everything in life, but even that, I did put myself in positions like this because I want to be here, and I'm really, really passionate about the message that I have. So yeah, I think when we look at innovation and we talk about innovation, we really, really have to be mindful of why do we need innovation and in mental health. And we really, really need it because the current model of care doesn't fit for everyone's needs all of the time. And I mean, this comes from the people who access services, but it's also backed up with mental health policy. And now we have big guns on board, the UN, WHO, who are saying we must be moving away from traditional practices. But even more important than that, we have decades of movements and people that have been standing up and fighting and asking for change. So the 2 projects that I'm involved in is Kerry Farms. So Kerry Farm is a therapeutic farm where guests go and stay for 3 to 6 months. So it's a step, it's kind of filling a gap between that community service and inpatient. And the key difference with it is that it's not led by psychiatry as well. So that's a different approach to mental health. So it's not to say there isn't space for psychiatry and medication in people's lives, but often it neglects all the social impacts and environmental impacts on a person, their trauma. And I know the services are getting better with that. I worked in the services for 7 years as a peer support worker, where I used my own experience of mental health and recovery to support people. I left that post 3 weeks ago, and I'm now working for Aware in another innovation project, there's so many of them, as clinical operations manager of their new Solace Cafe, which will be a crisis prevention cafe, again, an out-of-hours service that is filling that need for something that's missing that we don't provide. So I wasn't hired for my lived experience for that role. They were looking for someone with clinical experience, but when they saw, when I'm very open about my lived experience, they saw that as an asset really to bring into the role, which itself is progressive because there is a tendency to involve the lived experience, invite the lived experience into the room, but it's very tokenistic sometimes. And I did work in a team in the HSE for many years that were accepting and valuing of the peer support role. But overall, I think the system, it doesn't gel sometimes. And I think the importance of the lived experience should be in everything that we do. And I really find that being involved in these other projects that I'm involved in, it's just great to be in that for my own recovery, but also I just really value spaces that put the lived experience, because it is the most important voice in every room. And I'm not saying that for me. I know I'm biased to that, but I feel that now I've got so much experience that I'm a voice for those that maybe haven't got that voice yet, but it's about empowerment and voices and helping people and supporting people on their journey. So I know I spoke all about that. I probably didn't answer what you asked me.
No, it was perfect. And I really like the point that they didn't hire you in the Solace Cafe because of your lived experience. They hired you because you're brilliant, and they're lucky to have you. And we're very excited to see what happens when the cafe opens. So as someone who has accessed services, how important is innovation or innovative ways of being able to access services to you?
I think, I think, a lot of the general population, and I would have been one of these, one person as well before I accessed services in my early 20s. I didn't really know of all the services that were around that could support me. I thought, like a lot of people, I go to my doctor, I go to a medical profession, and I'm put on medication, and then I'm magically, fixed or cured. So I think awareness and really, spreading this idea that there are other ways that you can support your distress, and that it's not just primarily through the medical field. I'd be really strong about that in that, people have a right to know that there are other ways of supporting themselves through distress in life. And I think that community organisations, there's so many great ones at the moment. There's a lot of peer-led initiatives which are amazing, and it's run by people themselves who have lived experience. And if we look at all the research, everyone bangs on about research all the time, and it is important, but I feel it's ignored a lot of the time, because a lot of the research is saying peer-led interventions, and it's something we ignore and we continue to ignore. And but then it's other research, it's more valued. And is that a underlying and subconscious thing that we have in societies, that still we don't trust people with mental health? Is that at the core of underneath of everything that we do? But yeah, look, I could talk about all this stuff all day long, so I'm going everywhere with it.
No, and that's perfect, because you're bringing me back to Ruth now to bang on a little bit more about research. But I think it's so important. It's such a great point, like seeing all of the research that you've been involved in, but then what happens with the research, and is it actually been used in services and supports to improve?
Yeah, and just even absolutely, I think that's a really important and excellent point. And I think, it's timely in a way, because we're going to hopefully have the the mental health research strategy by sort of the end of the year, I think. And I think, you know, most of us would really like to see, you know, a key principle of that being putting lived experience at the centre of everything that you do. And I think if that's enshrined in policy, I think it would really help in terms of funding structures. So then all of a sudden that becomes the way that you evaluate whether a team gets a, you know, so I absolutely agree with you. I think there's been a lot of research, but it's now how do we enshrine that in policy so that it actually makes an impact, you know, on a broader level. So yeah, I think that's a really good point. Sorry, off topic.
No, and is it something then within kind of the third level institutions and within the sector that you would see that it's, what's it, PPI is the public patient involvement, isn't it? Like that tends to be now something within grants that you have to have.
Yeah, absolutely. So if you just think really practically in terms of research funding grants, which are sort of our KPIs, if you like, as individual researchers and as institutions. Some really nice examples even recently. So the Department of Health funded the HRB applied partnerships funding call, and that really is to support collaborations, and particularly where there's a research organisation or institution and an applied partner, so you know where potentially that research will be of use and used and implemented, and there's a really key focus there on work related to sharing the vision, so really specific, I suppose, to some of the work that's happening here. And also this year the Department of Health funded the HRB Evidence for Policy call, which again was much more, again, making sure that if you're involved in research that it's informing policy. But there are lots of other examples in terms of, say, SFI New Frontiers, some of the ERC New Horizon grants. So definitely what I've seen is that it's moved from nice to have to absolutely essential if you want to develop a good quality research project and proposal, and in order to be competitive. So it's, you know, logistically, it's really, really important. And I think making sure now that that's a key principle, I think in our mental health research strategy, is just going to really push that a little bit further, in my view, anyway. Yeah.
And to me, that links back to Stella and Kitty and the importance of having spaces where people with lived experience can come together, be supported, do the media training, you know, capacity building, and be encouraged to get involved in different research, but also be you know, have that safe space with, you know, your peers or like-minded people where you can kind of have a chat about different things. I know we all use loads of acronyms and things like that, so it's so great to see the Voice platform having so many people. We have a grassroots forum of 14 people with lived experience that inform our policy developments as well. There's also, in the HSE, there is a change and innovation in mental health team. Is Michelle here? I was told, Michelle, can I put you totally on the spot, Michelle, and bring the microphone down to you for a second, just to give us a quick update on the work that's been done in the Innovation in Mental Health Office?
Thanks. So I'm Michelle Butler, I'm General Manager in Mental Health Change and Innovation. We're leading out on two specific programmes. One that was just mentioned there is the Crisis Resolution Services Model of Care, which we developed and launched in 2023. And that consists of crisis resolution teams and the Solace Cafe, which is a crisis cafe for those supported in the community. And they're working really well. We have 5 learning sites across the country, one of which is CHO6, which is Aware as the community partner. And we also have CAMS Hubs, which is we have 5 learning sites. We've developed a model of care, and they're going to be intensive multidisciplinary teams within the community to support children and young people who are in crisis and need intensive support and treatment for about 4 to 6 weeks. So that's a quick snapshot, and we'll be filling you in with more developments. They're going to be evaluated and we'll share the learning, but there's great work going on at the pilot sites to date, and we'll be sharing the learning with everyone once it's finalised. Thank you.
Thank you so much, and sorry for putting you on the spot. I feel like one of those talk show hosts now, walking around with my microphone. I think something that came into my head as well, Ruth, about the lived experience and involvement, and, you know, tools that are available maybe for people with suicidal ideation or who have experienced self-harm, is self-stigma. is something that we don't talk about enough, I think. And if I won't, but if I was to ask everyone to put their hand up who had experienced some sort of mental health difficulty, either directly or indirectly with family members or colleagues, you know, a lot of hands would shoot up. So, but I think that's something as a society that we need to get better at. I have gone a bit off script again. I'm not looking at Connor. I'm going to do the thing of a wish list. So like the top overnight change, if I was a genie in a pink suit and could make something happen overnight with endless money, which I'm not and I don't, sorry. Yeah, so what would you, Ivan, I'll start with you again.
Okay, thanks, Bert. If the government was to pump a load of money into training and research clusters and networks in our society generally, to bring people who are working on common themes together to learn off one another effectively, okay? And to keep that going over time, I think that would make a massive difference, and it's one of the things we're in fact calling for. Also, the bit about research, it is absolutely crucial, but it can be scary and intimidating from the perspective of people who aren't professional researchers. So we actually need to invest in organizations themselves to give them the confidence and the capability to actually engage meaningfully with our universities and with the university departments where academic learning is taking place, because there's something about engaged research, we call it. So engaging people in the, because the expertise is in the room, the lived experience is here. We need to empower it to take control in a way of the research agenda and actually drive it. So training and research clusters and learning networks, but continually resourced through the National Training Fund, I might add. There's billions of euro in there, and the government won't release it because it will have an impact on spending levels elsewhere. So we're calling on the government to release millions, okay, for support training clusters and research clusters in the sector. Yeah.
Brilliant, thank you. Ciara, I'll come to you with your wish list.
I'll try and keep it short and sweet. I think really the overarching agenda, I think, is a paradigm shift away from the over-medicalisation of human distress, which I believe is just a normal reaction and response to life and environments. So yeah, a paradigm shift away from that to more rights-based, trauma-informed, recovery-orientated service, because they have all become buzzwords. And I don't think we're actually really working in a value-based way that is aligned to them. So yeah, I have loads on that list, but that's the top one. So thanks.
Thank you. Elaine.
So I think if I was to say, if I could wave a magic wand, what would it be? So I think within mental health services, but within healthcare overall, I think reducing structures that create a competitive space and turning them into systems that support collaboration and integration. That would be it for me.
Great. Ruth?
I suppose I was thinking, I think we use the term person-centred quite a lot, or, you know, putting the person at the centre. And I think if there was full implementation and rollout, I suppose, of electronic health records where people could access their own information and where ultimately funding would follow people, not large institutions, I think it would move from rhetoric to actually meaning something. And I think even from a research perspective, it would be really helpful.
And actually, just on that, before I come to you, Ronan, we're doing a piece of work with the London School of Economics about how funding in mental health is an investment. The return on investment, apart from, you know, lives and communities and well-being, the economic return is huge. We know the National Clinical Programme for Early Intervention in Psychosis, I think for every €1 spent on that, there's an €18 return. So even just talking about that side of things when we're making our arguments to the money holders, that's what we'd be talking about. Ronan, a wish list or a wish thing?
Well, I think there's four there, and I think it's great. I believe the shared care record has been brought to government this morning, which would be an enormous step forward.
I thought they did that because of this event. I thought they were trying to.
But I really think that could revolutionise services. For me, it's and to be honest, it was put better than I will put it now. But when I reflect on my previous role in the department, I think to really have impact and to influence the policy making and the political environment, there really is a need for the sector to speak with one voice and to focus on the strength in numbers. Like you said it, if you ask people in this room, or if you ask people in any room in the country to put up their hand if they've been affected or their family member has been affected, the majority will put their hands up. So this is something that resonates across the population. But I think at times that the ways in which the sector approaches funding and resourcing, it tends to, it's not as joined up as it might be. So I think speaking with one voice would really help to move things forward. And I know it's very easy to say that. I know it's a lot harder to do it. And I say that both from the perspective of from the sector itself, but also from the perspective of having been on the other side. Whereas if you have multiple requests coming at you, like, believe it or not, there are very limited resources in the policy-making environment to focus on any one thing at a point in time. And if you have one coherent set of asks coming that are integrated, it's much easier to understand those and to prioritise those and importantly, help you as a policymaker make the case for funding to deeper, versus having innumerable different requests coming at you that you're never going to get over the line on the other side. So it's just that one sector mentality.
It's a really good point, and it's going to I'm going to counter it slightly with the fact that we often, so mental health crosses all departments in government, but if we go to justice or housing or education, social protection, be like, oh no, talk to Minister Butler, that's mental health. So what we would love to see would be that cross-governmental agreement that mental health and well-being does cross across all of the departments, and it's not, you can't just fit it neatly into any of these boxes. And that's something we come up against all the time. It's like, no, that's disability allowance, so that's social protections, and that's youth justice diversion scheme, so that's and it's why one of our key asks in mental health reform for so long has been the reinstatement of a national director for mental health at the reporting directly to the CEO. So it remains to be seen what the restructure is going to bring, but that we're doing and trying to do everything we can as a sector with coalition groups like ourselves and the Wheel and DFI and others, but it would be great to have government meet us a bit of the way, even just with that acknowledgement of, yes, this is a cross-departmental issue, and we know that no decision made at Cabinet won't have an impact on people's mental health at some point. And I think hopefully today, from our 7 members that spoke earlier, like that's just a small snapshot of some of the amazing work that's been done across the whole country. So before we wrap up with a couple of minutes, so instead of opening the floor to questions, I am going to ask you to hang around for tea and coffee and lunch, unless anyone has one burning thing. Instead of how did we get all of this information into just a couple of hours this morning. So I'm going to thank my panel very much, Dr. Ronan Glynn, Dr. Ruth Melia, Elaine, Ciara and Ivan. And just before we finish up, as I said, there is tea and coffee and lunch back out in our lovely area, so please do stay and network some more. The whole point of this day has been around getting people to talk to each other who may not have got a chance to meet, or just meeting in person again. So Conor asked me to just quickly close. So we have someone we haven't mentioned yet today, and I can't see where he's sitting, is Kevin. Oh, I see him there behind. So Kevin, Conor and Meja are our amazing innovation team in mental health reform. There's only 9 of us. So we're a small but mighty team, and so just all the reports and everything that Fiona was talking about this morning, brave new connections and digital inclusion, just shout out to Kevin, who's hiding. He's not even looking at me now. Yeah, big props. And as always then, unflappable Aria, who was just getting up to help around and, just was out on the registration desk. And, a lot of work goes into organising events like this as well. So Aria and Wendy are our ops team. And then we've Julia out at the registration desk as well. And then Niamh and Stephen, our comms gurus and masters, have been just quietly going around taking, all of this stuff will be up on LinkedIn and everything like that later on. and then obviously Fiona, who you all met at the start. But we really a special thanks to our members who came for the showcase. So we had the ISPCC, we had Bernardo's, we had Jigsaw, we had Mental Health Ireland. I'm going to forget someone now. With Pavi and John, I said to John at the break there, I was like, it's not easy to stand in last minute, and Pa and Geraldine are normally at everything that we do. So a big thanks to John for standing in with that as well. St. Patrick's, all I kept thinking, Frankie, when you were talking about my portal, was the portal on North Earl Street. You should have trademarked that name. But yeah, so huge round of applause for our 7 members presenting. Thank you. And I did say shine, didn't I? Did I say shine? No, shine and shine. Yeah. And to Shauna for emceeing today, and Ruth for being our keynote speaker, and our wonderful panellists. So hopefully you'll hang around and have a chat with us now all afterwards. And yeah, thank you so much, everybody.